Hi guys, this is Misty Reed here. Just going ahead and checking in for our weekly fertility Q&A. I didn't have too many questions really on Facebook about fertility in general, but I did just go ahead and get done doing about an hour ago a live chat on Twitter. With a couple different organizations regarding PCOS and women that have PCOS and when they're trying to conceive. So I think what we're going to do today for this week is go ahead and talk a little bit more about PCOS, and hopefully that'll be of interest to some women out there. So September is actually PCOS Awareness Month. So we want to really keep this in the forefront of the mind because a lot of women actually go undiagnosed with PCOS. It's very common for women to go ahead and exhibit these symptoms when they're teenagers or in their early 20s. But if they're not trying to conceive at the time, then the diagnosis is often missed. And what happens is because these women have irregular cycles, they frequently get put on birth control. So PCOS Awareness Month is really trying to get the word out there about this condition and that it even exists. That way, hopefully more women can be diagnosed with it at a younger age because it's actually linked to a lot of other things, which is something that I'm going to talk about today. So PCOS, some of the symptoms are going to be irregular cycles, of course. Also, male sexual characteristics, so maybe like facial hair, darker arm hair, things of that nature. Those are some other symptoms. Not only do these women have irregular cycles, they tend not to ovulate at all, which causes the irregular cycles. And some of the other symptoms they have they have a higher risk for diabetes. They actually have insulin resistance, just to name a few. So those are some of the things. Now, some things that are important to know that are outside of that reproductive health realm is that women with PCOS are a lot more likely to have anxiety and depression. And a statistic that was shared with me today during this Twitter chat for PCOS awareness was that women with PCOS are 7 times more likely to commit suicide than women without PCOS. So this is huge, right? I mean, not only is PCOS something that affects your fertility and your menstrual cycle and actually affects your quality of life on a daily basis, it also affects your mental health on a daily basis. So how do you know if you have PCOS? Well, first of all, you might have had some of those symptoms I mentioned earlier, such as the irregular cycles, facial hair, insulin resistance, things of that nature. Now, if you do suspect that you have PCOS, I want you to know a little bit about the testing that might be done when you go to the doctor to discuss this. So traditionally, we've gone ahead and we've diagnosed PCOS if a woman has 2 out of these 3 things occur. So one thing is they test testosterone, and testosterone levels are high. That could be one thing that they find. Another thing that could be when they do an ultrasound on your reproductive organs, they find that your ovaries have a lot of cysts, and it kind of has like an appearance that looks like a strand of pearls is a way that they describe it. So that's the second thing that they could find. And then the third thing, of course, is irregular cycles. So if you have 2 out of those 3, that's historically been how they would go ahead and diagnose you with PCOS. However, this is changing, and we are noticing different parameters. It was historically thought that women with PCOS were always overweight. That's not the case anymore. Lots of women that are within a normal BMI or even on the low end or under a healthy BMI can have PCOS. That is possible. We're also finding other parameters that we can test for with the blood that may be of use. For example, AMH, also known as anti-Mullerian hormone, is something that they usually test to see if a woman has diminished ovarian reserve or something of that nature. But they're also realizing that if AMH is over 4, that's also a good indication that perhaps this woman has PCOS and more testing is needed. So certainly as we continue to do more research and get more information about how PCOS works, we'll be able to come up with better diagnostic criteria. But right now, if you were to talk to your doctor about it, don't be surprised if they want to do an ultrasound, if they want to do blood work. They might also want to go ahead and look at your insulin resistance. There's some ways that they can check that in the blood. Look at 5A1C, for example, as well as some other things. So that's just something that we want to keep in mind. The biggest issue, of course, with PCOS when women are trying to get pregnant is they aren't ovulating. And if we're not ovulating, we're not releasing an egg, right? And if that's the case, then, of course, you can't get pregnant, right? Because we need an egg and a sperm to meet to make a baby. So for these women, sometimes drugs such as Clomid and Femara are used to go ahead and initiate ovulation, which can be helpful. But if it's a really severe case of PCOS, then just triggering ovulation once usually isn't enough to get her cycle to keep occurring. So what I find with these women is what I do works really well. So Chinese medicine is great at looking at the whole picture. We call it a whole systems medicine. So we really look at all of your organ systems, look at everything going on with you so I can come up with the proper diagnosis. And then using that diagnosis is how I would make dietary recommendations, maybe herbal recommendations, lifestyle modifications, all of those things. Because as I mentioned earlier, PCOS affects women of vastly different backgrounds. Certainly, it is more prevalent in populations where there's history of diabetes in their family. But however, it affects women that are overweight, women that are of perfect weight, or within their healthy weight range, I should say. No one's weight is perfect. It's women that have a healthy BMI, though, is what I'll say. Or women that are even under a healthy BMI, that are too thin, right? So if it can affect all those different women, then there's not necessarily going to be one best way to treat all of those issues. So I do encourage women, if you feel that maybe you do have PCOS, certainly go ahead and talk to your doctor about it. It's something that we definitely want to go ahead and get more information about, right? Not only can it affect your fertility and your reproductive health, but it can affect your mental health as well. So I'm going to go ahead and check the Facebook feed here and see if anyone has sent in any more questions. And I don't see any. So that is all for this week. I hope everyone's having a great week, and I will talk to you guys later. Take care. Bye-bye.